Hey guys, I get a lot of patients asking me about veneers, so I thought I'd do a video to answer some of the questions that you may have. Firstly, there are two types of veneers, composite veneers and porcelain veneers. Composite veneers are made of a resin material, the same material that's used when you get a filling on your back tooth. Now the benefits are that they're typically quicker, they're cheaper definitely, but the downside is they're not as strong as porcelain veneers, so they're more likely to chip. If you're prone to grinding your teeth, then they're not going to be as strong as either your natural tooth or the porcelain option. The process for composite veneers is typically 3 appointments. The first is a consultation appointment where we take some photos, a 3D scan of your mouth, and then plan alongside you what you want from these veneers, what you want the shapes to look like, what you want the colour to look like. From that point, the next appointment would generally be placing the composite veneers, and this is typically 2 or 3 hours depending on how many veneers you want. And then we usually do a follow-up appointment for final polishing or tweaks or anything that you might want to change. And this typically comes a couple of weeks after that placement appointment. And that's it. It's pretty straightforward, pain-free. Most of the time we don't even need to do any injections unless there's decay in your existing teeth. But yeah, it's quick and straightforward. Here's an example of a case we recently completed on one of our lovely patients. As you can see, they look fantastic. This patient had a lot of wear from grinding his teeth, and now we've restored his teeth back to what they used to be. We've also made this patient a mouth guard to wear while he sleeps at night, so it protects the composite veneers for as long as possible. But typically you'll get somewhere between 5 and 7 years from composite veneers, as long as you protect them as we would advise you how to. So porcelain veneers, they're more expensive admittedly than composite veneers, but the benefits that you get are the aesthetics are much more improved. They won't stain, and they're much stronger than composite veneers. So we typically find that our patients that grind their teeth a lot generally go for porcelain veneers to give that long-term stability and protection to their teeth. So we're going to go through a case now for a patient that we completed in the last couple of months, just to show you the stages that are involved. So firstly, as with any aesthetic treatment, we have a long consultation appointment which involves photographs, a 3D scan of your mouth, and from there we can really start to plan the case, generally hand in hand with you. And so you can see here that one of the photos that we've got, we draw on there to show what we're trying to achieve so that we can, 1, communicate that with you to see whether that's what you're after, but 2, be able to give that to our lab technician who makes the porcelain veneers so that we can align your goals with what they're trying to build. So after that, they'd create a 3D model of what we're hoping to achieve with your veneers, and we'd get you back in a couple of weeks later generally for what's called a trial smile appointment. And you can see the photo here. We've basically tried in the planned final look of the veneers in terms of their shape. And this allows us to see, are the shapes right? Does it suit your face? Are you happy with how things are generally? You can kind of see it's a bit rough because it's not polished like the final veneers will be, but it gives us an idea of, do things look okay? The next appointment will be the preparation appointment, and this is where we'll usually take between 0.3 and 0.5 millimeters away from the front surface of your teeth. Now there's a common misconception that veneers involve hacking your teeth down to little stumps, and with digital dentistry and modern materials, this just simply isn't the case. Quite often, after we've prepared your teeth, you won't even know from the front that we've really done anything. It's so minimal the amount of tooth that's needed. From here, we'll put some temporaries on. As you can see in this picture, the temporaries are going to be a copy of what the final veneers are going to look like. And this gives you a really good idea that everything's going to go to plan. We really don't want any surprises when the final veneers come. So if there's anything wrong at the temporary stage, you can tell us, and then we can pass that on to our technician who can make changes before we make the final veneers. The next appointment then is the insert of these veneers. So it's usually 2 weeks after the preparation appointment, and we'll get you in. We'll try the veneers on, we'll really give you a good look at them, make sure you're completely happy with things. And if you are, we'll cement them on. Once they're on, we generally like to see you a couple of weeks later just to review things, see how things are going, make sure you're happy with everything. And after that, you've got your final veneers. As you can see here, it's a really lovely result for this patient. She had some composite bonding done in the past, and she ground her teeth quite a lot, so you can see that they're worn down, they've yellowed over time, and she's really happy with her new smile. So if you have any questions, don't hesitate to reach out. Cheers.